For decades, statins have been the cornerstone of cholesterol management, but they're no longer the only option. Today, we stand at the forefront of a therapeutic revolution. From advanced monoclonal antibodies to next-generation gene silencing strategies, the field of lipid-lowering therapy has evolved dramatically. Whether you're a clinician navigating complex cases, a researcher exploring emerging solutions, or a learner seeking clarity, this is your definitive guide to the future of lipid management. LDL cholesterol. The core risk. Low-density lipoprotein cholesterol, LDL-C, is a well-established driver of atherosclerosis. Levels above 70 milligrams per deciliter significantly increase the risk of myocardial infarction, stroke, and cardiovascular death. Statins remain the first-line treatment, but they aren't always sufficient, and up to 1 in 5 patients experience intolerance or fail to reach target LDL levels. For these individuals, emerging therapies offer new opportunities for risk reduction. PCSK9, or proprotein, convertase subtilisin, or kexin type 9, is a protein that regulates cholesterol by binding to LDL receptors and targeting them for degradation. When PCSK9 activity is elevated, LDL receptors are broken down faster, reducing the liver's ability to clear cholesterol from the blood. Inhibiting PCSK9 allows more receptors to remain active. Among the most impactful therapies are the PCSK9 inhibitors. Alirocumab and Evolocumab, 2 monoclonal antibodies, have demonstrated LDL-C reductions of 50 to 70%. Clinical trials such as Odyssey Outcomes and Fourier confirmed substantial reductions in cardiovascular events including heart attack, stroke, and cardiovascular death. Another breakthrough is Inclisiran, a small interfering RNA therapy. It targets the mRNA responsible for PCSK9 production, reducing LDL-C levels by 40 to 50% with just 2 injections per year, offering lasting control and improved adherence. The Orion trial series has demonstrated its efficacy, safety, and potential to improve adherence significantly. Clinical evidence and long-term safety. These therapies are not only effective, but also clinically validated. In both primary and secondary prevention settings, PCSK9 inhibitors significantly lower major adverse cardiovascular events. Safety profiles are favorable. Most patients experience only mild injection site reactions. Some report flu-like symptoms or fatigue. Neurocognitive effects have been noted in rare cases, but no consistent pattern has emerged in clinical data. Overall, these agents are safe and well tolerated. Understanding statin intolerance. One of the most common barriers to optimal lipid management is statin intolerance. This includes muscle-related symptoms like myalgia, or, in rare cases, myopathy and rhabdomyolysis. Intolerance can be partial, where lower doses are tolerated, or complete, where all statins are avoided. These patients are often left undertreated and at elevated risk. Managing intolerance. Managing statin intolerance begins with strategy. Switching to more tolerable statins such as pravastatin or rosuvastatin, adjusting dosing schedules, or using alternate day dosing may be effective. When statins remain problematic, non-statin therapies become essential. This includes ezetimibe, PCSK9 inhibitors, and a newer agent, bempedoic acid. Ezetimibe, blocking cholesterol absorption. Ezetimibe works by inhibiting the NPC1L1 transporter in the small intestine, reducing cholesterol absorption. On its own, it lowers LDL-C by 15 to 20%. Combined with statins, the effect is additive. The IMPROVE-IT trial confirmed that adding ezetimibe to statin therapy reduces cardiovascular events, offering a reliable step-up option for patients needing additional LDL-C reduction. Bempedoic acid is a novel oral agent that inhibits ATP citrate lyase, an enzyme upstream of HMG-CoA reductase. Because it is activated only in the liver and not in muscle tissue, it avoids the muscle-related side effects often associated with statins. It reduces LDL-C by 20 to 25% as monotherapy, and by up to 40% when combined with ezetimibe or statins. The CLEAR Outcomes trial is providing further insight into its long-term cardiovascular benefits. What's next? Future therapies in development. Emerging therapies continue to expand the treatment landscape. CETP inhibitors such as anacetrapib aim to raise HDL and lower LDL, though early results have been mixed. Small molecule ANGPTL3 inhibitors offer the promise of oral alternatives to current IV-based therapies. Gene silencing techniques targeting ApoB are also under investigation, with the potential for long-term or even one-time treatments that reshape cardiovascular risk management entirely. Evolocumab, a lifesaver for genetic cholesterol disorders. For patients with homozygous familial hypercholesterolemia, a rare and severe genetic condition, Evolocumab offers a powerful solution. It inhibits ANGPTL3, a protein that modulates lipid metabolism, enhancing lipoprotein lipase activity. This results in dramatic reductions in LDL-C and triglycerides. In phase 3 trials, Evolocumab reduced LDL-C by up to 49% in patients with HoFH, where most therapies fail to work. Beyond LDL, addressing the full lipid profile. Modern lipid management isn't just about lowering LDL-C. Triglycerides, HDL-C, and other lipid fractions also play a role. Agents like icosapent ethyl, a purified EPA formulation, have shown significant cardiovascular risk reduction in the REDUCE-IT trial. Fibrates are helpful in managing hypertriglyceridemia, and although niacin has largely fallen out of favor due to side effects and a lack of demonstrated benefit, it remains a tool for select patients. We are entering a new chapter in cardiovascular medicine. With tools such as PCSK9 inhibitors, bempedoic acid, Inclisiran, and Evolocumab, we now have the capacity to personalize therapy, overcome statin intolerance, and dramatically lower residual cardiovascular risk. This isn't just about lowering cholesterol. It's about saving lives with precision, clarity, and care. Thank you for joining us on this journey into the future of lipid management.